And I believe we have a good amount of our attendees. So if any other team members are going to be turning on their cameras for greeting, you are more than welcome to. Dr. McCracken and I are going to remain on camera throughout the presentation, and we did draw a couple points to really the differences of what you're experiencing here with a Zoom webinar versus a Zoom meeting, which I know we're all very familiar with at this point. So the main thing is, like I said, even though hopefully you can see me and see Dr. McCracken and hear both of us and see our presentation, rest assured that we cannot see you. No other attendees can see your name. This is a HIPAA compliant webinar. So you are kind of in view only mode as an attendee. And the reason why we want you to be aware of that is, of course, we do want to protect your privacy. We will be doing a couple things throughout the presentation to make this a little bit more like we would be able to interact with you if you were on site with us. And the things that you're going to see are the polls and the Q&A. So as we go through our presentation, as with anything, we really want to make sure that, for one, we make sure we answer all of the questions that you may have come with today or that may come up throughout the presentation. So do feel free to use that Q&A button. As people were hopping on, you may have heard me say this, but depending on your device, you're going to see a little Q&A button either at the top or maybe at the bottom of your screen. And that's how you're going to be able to ask us questions throughout the presentation. We'll take probably the most 5 popular questions at the end, and we'll go ahead and do an open Q&A. And then rest assured that anything that we don't answer on the webinar, you will have your individual private consultation with Dr. McCracken. That's going to be on TheraLink. So just to get the techie stuff out of the way, you'll see polls pop up. That's going to help us be interactive as you're answering those. That'll help us tailor our presentation. And again, do be aware that only we as panelists can see any interaction from attendees. No one can see your name by participating in a poll. And if you do ask us any questions through the Q&A, only we can see those. So nobody else will be aware of your interaction there. And then after we get done with Zoom, this webinar, this virtual event, is taking place on 2 different platforms. So Zoom is what we are going to be going through the presentation on here. That's where we're going to be doing the Q&A. That's where we're going to be pulling the prizes at the end, and we'll walk you through how we're going to protect your privacy there as well. But we do have some fabulous giveaways for those of you joining us today, some fabulous pricing that we'll share with you as well, and all of those details of really what this procedure means for you, your candidacy, how exactly many grafts you might need, which we'll talk all about grafts today, to accomplish the result you're looking for. All of that is going to be accomplished in your virtual consultation on TheraLink. So after we get done with our Zoom webinar, a lot of you are already scheduled for virtual consultations on TheraLink. If you're not, you can either go ahead and put your name and your phone number in the Q&A, and either Mame or Christy or Lindsay or somebody from the team will go ahead and reach out to you to schedule you a virtual consultation. Or you can go ahead and just call the office and they'll get one set up for you as well. But following the webinar is going to be consultations on TheraLink. And then after you do your consultation, if you do want to go ahead and move forward, lock in the event only pricing, get your gift certificates that come with that, then the team will call you after you have your consultation with Dr. McCracken. So we'll get through our information here. Do participate in the polls, the Q&A. We'll enter you into some fantastic prizes. We will do a Q&A at the end here based on those conversations that we see coming in throughout the presentation. You'll have your virtual consultation on TheraLink. That's where you'll get to see exactly what this procedure means for you, what that cost is going to be, and what you're saving by locking in today. And then the team will go ahead and call you and get that all set up for you afterwards. Dr. McCracken and team, I know we offered some wonderful pricing to get people here today, and we offered some wonderful prizes as well. So the three main ones that we want you to be aware of as far as prizes go are going to be the grand prize, which is one free PRP treatment. I'll let Doc speak to why we included PRP. And then the second prize is a Skin Medica skincare kit. Skin Medica is an amazing skincare line. And the third prize is one syringe of Restylane, which is a filler. And depending on what brought you here today, I know we marketed this event as a kind of a Father's Day event. Of course, it is June, so a lot of our marketing and a lot of our targets are going towards dads and guys right now. But do be aware, and you'll see some examples of this within our before and afters, that yes, NeoGraft is a hair restoration technique that a lot of men are going to be really drawn towards, but we also see a lot of women and ladies who really benefit from this as well. So moral of that story is that if you're not familiar with using filler, you're not familiar with skincare, you can either keep it or gift it if you win either one of those. As far as the pricing goes, if you do want to go ahead and lock in your NeoGraft procedure with Dr. McCracken, you will be getting $500 off your procedure, and you'll also be getting a $250 Botox card. So as I'm going through these pictures of these before and afters, I'm like, oh yeah, we could use a little smoothing of those wrinkles now that that forehead looks so fabulous and that hairline looks so great as well. So any of your prizes that you win, you are welcome to use them yourself, get a full-on anti-aging remakeover, or you could of course gift them if it is something that you want to give to a partner or somebody else. And then our main grand prize is a PRP treatment. So Doc, we'll get into the whole procedure of NeoGraft and FUE and really what hair restoration is. But do you mind sharing with us a little bit about PRP and how that plays into the treatment plan and why we chose that as the grand prize?
Yeah, PRP stands for platelet-rich plasma, and what that is we draw blood from the patient and we spin it down to get the layer that's rich in platelets. Platelets have a lot of growth factors, and so we can inject those platelets with their growth factors into the scalp, and that oftentimes will promote hair growth. Now, that's sometimes a standalone treatment in guys who aren't experience a lot of thinning. Once you get to the point of needing a hair transplant, PRP in and of itself is really not going to be very useful, but we do use PRP along with the transplants to act, if you will, as a fertilizer to help the transplants take. And also after a transplant, we encourage guys to continue up with PRP every 6 months or so. So this is a great prize for guys who maybe aren't ready for a transplant yet, or even guys who do get a transplant, or gals for that matter. This is a good way to kind of keep up and do maintenance, if you will, on the transplant.
Beautiful, good. So it's really an enhancer for making sure those grafts have the best possible place to live and to grow in their new homes, and then also can be used as a kind of a maintenance to make sure that we're getting those long-term results that we're looking for. So we've got wonderful prizes. You guys have great pricing for joining us here today. And before we move into our information, we would love to know and go ahead and vote on the poll once it pops up in your screen there. Again, these are anonymous. We'd love to know who we have here with us today. So are you a current patient of the practice, and you know how wonderful and fantastic this team is? They've been so lovely to work with. It's been such a great process of planning this virtual event. So they're a wonderful team. A lot of you know that as these answers are coming in. You've got a lot of current patients on the call here. A good amount of us have a family or friend who's maybe a current patient. So either a husband, wife, some kind of a relative perhaps who's referred us here. And then we do have a good amount of new patients as well. So I'm going to go ahead and end our poll here and just share those results so you can kind of get the lay of the land of the way that those polls are going to function. So we've got a good amount of us. Most of us are current patients. You're familiar with this fantastic practice and provider. Some of us have been referred here today, and about 33% of us are new. So welcome to each and every one of you. And without further ado, let's go ahead and get into our information. So all of us have been drawn to this event by the fact that it is hair restoration, and we're going to get into what FUE means and really what that technology can do for you, maybe versus what was available for us in the past. So I think hair restoration is one of those things that maybe we don't love to talk about, but we know that it is really affecting huge numbers of us. So 35 million men, at least 21 million women across the US are experiencing hair loss in some different way. Big percentages of us, 60% of men, and at least 40% of women are experiencing what they would call significant hair loss by the age of 60. And we know that, right? We know that hair loss is a part of aging. But doctor, since you've got so much experience within FUE, something that you said within our training kind of caught my ear. And I think you were saying that you were treating a gal in her, even as young as in her 20s.
Yes, yes. And in fact, we just saw her in follow-up yesterday. We had hoped to have her photos ready to put in the presentation, but that wasn't something we could do. But I believe there are some women on the call today or on the webinar, and certainly women are candidates as well.
Absolutely. And not only women, but, different body parts too. So, we'll talk about the majorities that we see, which is, restoring hair density. Us as women, a lot of times will kind of thin in this upper crown area and kind of come in an interesting pattern all throughout, whereas maybe typical male pattern baldness is what we're used to seeing with that kind of horseshoe ring in the back, temples thinning, and then of course coming into the crown as well. So it's a really customizable treatment with FUE, and we'll show you exactly why. But what we found most of the time, that once folks are really looking into FUE or hair restoration, they've become really familiar with what's important to them. So I'm going to go ahead and stop sharing that first poll, and I'm going to launch our second. And this is really a specific question to you, for you to be asking yourself as we go through information about what really is most important to me, male, female, different body part. What is it that's most important to you when you're choosing a technique or a procedure for hair restoration? Is it the most possible efficacy? So you're actually getting the most out of the procedure. Is it the fact that you're looking for natural results and being able to wear your hair in any style? We'll talk specifically about that with FUE. Do you want to have minimal downtime, right? We're all busy. Really, nobody likes to go under general anesthesia if they don't need to. And most people like to get back to their activities pretty nicely. We want it to have a nice lasting result. We'll speak to that specifically. Doc spoke a little bit about that with PRP, and we'll speak to that specifically with FUE. A lot of times people don't want to have visible scarring, right? With anything that we have done, be it a facelift, be it hair transplantation, anything like that, we do not want to have visible scarring. A big thing for a lot of people is experience of the provider and really looking at some of the treatments that they've done in the past and being able to speak from that personal experience. Or is it all of the above, right? As we're doing our research and looking through these different things available, what's going to be the most important to us? I'm going to go ahead and end our polling here, and no surprise as I share our results that most of us are looking for all of those things. So it's a good thing that you've come here today, because that's really what we're going to be focusing on, is the efficacy, is the fact of being able to wear your hair in any hairstyle, not having any big visible scar across the back of your head, of course the experience of the provider, the team, and more than anything, we're looking for all-inclusive results all across the way. So thank you for participating in those introduction polls there. And as we get going, these are the things that we find most commonly. So most of us are looking for an awake procedure. Most people don't want to have downtime. Most people don't want general anesthesia. As we get into FUE versus our traditional or conventional strip surgery, you'll see some pictures that maybe some of you on the call are familiar with a big linear scar across the back of the head. Most people would rather not have that. Again, we're looking for natural results, a high take rate, meaning that the follicles that we take from our own donor site, this is your own hair, which is exactly what we're looking for. So the follicles that we take from the donor site are going to have a very high recovery and take rate in the area that we place them that's specific for your hair restoration. And we want to be able to recover quickly. We're going to get into the benefits of FUE versus strip. And I'm sure your eyes are going directly to that left-hand picture there where we can see that scar all the way across the back of the head. And then, of course, you see FUE, or the machine that we use here is called NeoGraft. So those are going to be simultaneous. NeoGraft is follicular unit extraction, which is what FUE stands for. And let's just go ahead and launch our last poll here, where we would love to know, so we are not speaking above or below our audience here, is this something you're familiar with? Are you aware of the conventional strip method? Is that something that you have been researching? Or are you familiar with FUE, or is this new for you overall? So let's go ahead and let our poll numbers come in here. It's ebbing and flowing and ebbing and flowing, and as people are putting in their answers here, and it really seems that we're pretty split. Let's go ahead and, oh, well, we got one more in there. I'm glad I waited a second. So honestly, 100% split. So we will share with you everything about FUE versus strip, but a lot of times, as I said, these procedures are not something that you're hearing for the first time today. Normally, this is not something that's come up overnight for you. You've done some research on it, so we are in good company here. And
can I just add something, Stacy?
Please.
Sorry to interrupt. When we look at the strip method scar, we do have a lot of patients that come to us having already had a strip transplant, and of course they don't like the scar, and they ask for FUE, which we do. But we can also sometimes add grafts along that scar and get them to take, and so sometimes we can cover up that scar if it's really bothersome. So I don't know how many attendees have already had a transplant before, or maybe a strip, but we can use the FUE method to conceal those scars as well.
That is a great point to bring up. And even took that poll a little bit further, is maybe some of us aren't just familiar with strip, but maybe some of us have even had it in the past. So that's a wonderful revision that you can speak with Doctor about as well. If we are starting from the beginning, right, and this is our first hair restoration procedure, you do want to be aware that NeoGraft or FUE doesn't have that big linear scar in back, because we're only harvesting the follicles that we're going to use. We've got a couple videos in here that we're going to show you exactly how that looks. But what that means is, for one, yes, you don't have a big linear scar in back, because most of the time we're taking hair from what we call a donor site. And if you think about, any man who loses hair, really any of us as women, I think all of us can agree that this back portion of our hair is the thickest and the densest. So we're going to call that the donor site. And in strip method, we're actually going in and excising that entire strip in the back of the head, and then we'll go ahead and slice through it and extract the follicles. And by nature, that's going to affect the integrity of some of those follicles, versus if we're just taking them individually. For one, we don't have a big scar, which people love, but two, and maybe even in some cases a little bit even more important than not having a scar, is the efficacy rate of which those follicles transplant into their new home. So yes, no scarring, but also maybe even more importantly, it's going to make the grafting that much more efficacious, because those follicles stay intact and we don't have to dig through a strip in order to get them out of there. And then that's an awesome point, that if you have had strip in the past, that doctor can really look and see how we can maybe kind of camouflage that with doing some grafts over the top of it. And if you're kind of techie and like science like I do, this picture is going to be really cool. Some people, this might be a little bit gross, but I love looking at this picture. And what you're seeing here is the actual grafts. So So you can see those FUEs being taken out. You can see the follicle of them. You can even see on a couple of them how maybe some of them have 2 or 3 hairs versus some of them have 1. So what you really want to know is that when we take FUE and when we take those follicles from that area that tends to be the least resistant to change, right? The least resistant to hormones, to age, to stress, this hair is the most resilient. And by really cleanly taking those grafts out, only taking what we need, for one, this area heals beautifully. You can't even really tell after a couple days. But 2, the hair keeps those same properties. So what was our thickest and densest, most resilient hair back here is now going to keep those same follicular properties in the area that we've transplanted it. And then you can see with the strip that we're taking, you know, really this whole section of scalp and of the follicles that come with it. We would go through, sliver the strip, dissect the grafts, and then go ahead and insert them. Versus FUE, follicular with NeoGraft, you can see we're just punching just those individual follicles, leaving the skin and everything around it intact. And then those follicles will keep those same wonderful properties from the back of the head when we implant them in the front of the head.
And if I could make a couple of points on this slide, Stacy did a great job talking about the donor site as far as the density of the hair. But the other thing is that the hair in the donor site is less susceptible to loss over time. It's much more durable hair. So that's another great thing about it, is we talk about donor site dominance, meaning that when we take hairs from that back of the head, the donor site, they maintain that durability even when we move them somewhere else. So they're much more durable hairs, and they'll last up in the front even over time, as some of the other pre-existing hairs may fall out. And another point I would make about this FUE slide on the left there is that Stacy had mentioned with the strip method how the grafts are dissected by hand, and there's a lot of manipulation of the grafts. And with the device that we use for our FUE, not only does it use tree fine to punch those follicles out, but rather than grabbing them with forceps, which I think is what they're trying to show in the diagram there, we actually use suction to collect those grafts. And so it's much less traumatic to the grafts, and it helps to provide a higher survival rate for those grafts when we transplant them. And we'll talk about survival rate, I know, in a couple slides here.
Yeah, absolutely. I know, Doc, when we were really preparing and kind of going through the most important things for us to share with folks, one of the things you wanted to make sure we talked about was not only FUE and the, you know, efficacy of what that means for that graft, but also that it comes out in a cylindrical fashion. What exactly does that have to do with you know, how effective that is for when the graft comes out, the method of removal?
Well, we don't have a slide here showing the grafts, but if I were able to show you a slide of grafts that were cut by hand, I think you can imagine that there's some irregularity. Whereas when we use this tree fine to harvest the grafts are very smooth and pretty much perfectly cylindrical. When we go to implant the grafts, we use a needle to make the hole. And I think if you imagine putting a perfect cylinder into that needle hole as opposed to something that's irregular, I think it helps promote retention of those grafts. Not to mention, again, the less manipulation of the grafts when we use FUE over the strip method.
You'll see an example of what Doc is referring to on one of the following videos here. You know, we love FUE for all of the reasons above, right? It's very effective. We're going to get a great efficacy with that take rate. It's going to retain that donor dominance wherever we're placing it to, and we're really able to use all of the follicles that we extract because of the integrity of the way that they're extracted with that cylindrical suction. Of course, people don't love to be under general anesthesia. This is an awake procedure, so we will let you know kind of exactly what to expect when you come in for a procedure with Dr. McCracken and his team. This is a minimally invasive procedure. It really does have pretty minimal downtime, especially if we're comparing it to a full-on surgery with strip. We'll let you know kind of what that pre and post care looks like, but definitely the most minimally invasive with the efficacy rate that we're seeing, and it is a safe procedure. And like we said, it really allows for kind of creative, individualized placement. If you are somebody who's experiencing temples, if you are somebody who's experiencing crown versus overall thinning, we're really able to customize the treatment. Another option out there that maybe isn't as heard about as much anymore is, you know, there's robotic things that can do procedures like this as well, but we're working by hand. We're working every day within this technology. So it's something that, you know, yes, the machine is cutting out those beautiful cylindrical follicles, but by working with an actual placement technique, we can customize this per patient, and you'll see that on a couple of our before and afters here.
And the other thing I'll say, since you brought up the robot, is that the robots, everybody loves the idea of robots, but the robot is only good on certain hair colors. It can't be used on everyone. And the robot still is dependent, once the robot drills those follicles, it's still dependent upon somebody to extract them with forceps. And so I feel that the FUE technique we're using is a little less traumatic to those follicles.
Absolutely. Yeah, it keeps them happy, and happy follicles are what we want, because that's what's getting us a 95 to 98% graft take versus about 50 to 60 with your strip or other methods out there. And that really does have to do with the way that that follicle is extracted. So the most obvious kind of benefit is the fact that yes, with FUE, you do not have that big linear scar on the back of your head like you saw originally. But what we get really excited about results wise is the fact that that graft take is really that much higher because of that extraction method. You're going to get a natural looking result. Most of the time people are returning to work the next day. Again, you've got fairly minimal downtime. You can wear your hair however you would like. There are no stitches, no staples, no linear scar. Most of the time it's a very comfortable procedure, again, done right there in office. A lot of times you'll start in the morning, have a little lunch break, check your email, finish up in the afternoon, and then you'll get a ride home. This is, with FUE, the least invasive option available for hair restoration. And then you can see, of course, on the strip side of things, we're looking at that linear scar, hairstyles to be able to cover that. Of course, more restrictions, being that most of the time you've had an actual surgery, maybe about a week off of work or so. And maybe perhaps the most important thing there is really that graft rate and the integrity of what's being harvested and kind of taken out of that strip by hand versus the integrity of the grafts that are coming out with FUE. And you'll see exactly what we mean here. So we said 95 to 98% take rate as it preserves that follicle, again, keeping those donor dominant properties. So what was happy and thick and resilient back here will remain happy and thick and resilient where we put it, in that donor to the recipient site. And what you're going to see in this video is exactly what Dr. McCracken was referring to with the suction and the cylindrical graft take.
And what we're taking, that's a patient we did here in the office, and we're taking one out of every maybe 4 follicles or so in the back. And so you don't get thinning in the back when we harvest.
Yeah, I've heard people refer to that as you're leaving healthy islands all around where you've taken your grafts from. So it all kind of grows back together very nicely because you're not taking the full thing like we would be with strip, just taking what you need. And then on our second one here, you're going to see implantation. And you can see those grafts being individually placed right in those holes that Doctor had described. I'm going to play that again, and Doc, let you add anything to that.
Yeah, and so as you can tell, we're individually placing these follicles into those little needle holes that we've made, the recipient sites. In this patient, those recipient sites go probably about 4 or 5 inches posteriorly. You can't see all of them. The follicles do stick up just slightly. The most important point to remember when we put these follicles in is that they're held in just by a blood clot. And so everything in the recovery period is really based around babying these grafts and being very gentle, not wearing a hat that can, you know, rip those follicles out when you take it off, not sticking your head under the running water in the shower for the first couple of weeks. So we really need to baby these grafts for the first couple of weeks. No exercise is the other really important point for the first couple of weeks.
Normally say about 2 weeks for that, Doc?
2 weeks, yeah. And we'll talk more about that. I think we have a slide on recovery.
Yeah, we sure do. Our videos want to play over there. And then we wanted to speak to this point because I'm sure lots of us who have come to this point, maybe we've had a hair restoration before, maybe it's something that we've actively been looking through to have done. A lot of us are going to do kind of maybe the most minimally invasive. So things like Rogaine or your minoxidil, your Propecia, of course, your hair growth shampoos and supplements. I know I have them in my house for my husband. So Doc, when folks come to you and are looking to have FUE with NeoGraft, how do you recommend? Are they still taking their minoxidil? Do they still take their Propecia? Kind of what's your advice with either stopping or starting those measures?
I think it's fine to if you're going to be having the transplant done, it's okay to continue the Propecia. We stop the minoxidil about a week ahead of time and for the first 2-3 weeks afterwards. But these things can be helpful. I mean, I know I had a hair transplant. I did FUE myself about 1.5 years ago, and I had tried the shampoos and I had tried minoxidil. I did not try Propecia. Most guys know that there's a risk of sexual side effects, and most guys aren't too excited about that. So to be honest, I don't have a lot of guys that go down the Propecia path. But these things can be good to retain the pre-existing hair after a transplant. When I talk to guys and they tell me, you know, I had a hair transplant and it did well for 1 year or 2, and after that they just all fell out. Well, usually what happens is it's not the transplanted hairs because they come from that very durable site, that donor site, but rather it was some of the surrounding pre-existing hairs that just continued their pre-existing predetermined pattern of falling out over time. And so some of these other things, Propecia, minoxidil, and shampoos, and PRP also can be used to retain some of that surrounding hair to surround the transplanted hair.
Yeah, absolutely. So a lot of us may be kind of using preventatively, kind of keep things where they're at. And that same thing can be used post-procedure. And of course, the practice would be walking you through when exactly you want to bring those modalities and those treatments back in and how long you want to avoid them for. All of us have been locked in our home, so my husband hasn't had a haircut. So his hair's very long. It's getting very long and back. It's almost to the point where he can put it back. And he's like, oh, let me look in your mirror. Let me look at the back of my hair to see how long it's gotten. And lo and behold, he knew he was thinning up here, but he didn't have that visual of what was happening back here all the time. So now he's got a whole other thing to worry about. I'm like, yeah, I shouldn't have given you that mirror. And like we mentioned, you can treat additional areas. So obviously we're talking about male pattern baldness. Obviously we're talking about thinning. That's very common with a lot of us women. But do be aware that we can place those grafts, eyebrows, chest hair, beard. Again, it's your hair. So it's going to be receptive on your body in different areas. So if there is something that you're kind of curious about restoring, do go ahead and make sure to talk to Dr. McCracken about that when you have your consultation, because there's a couple fun ways we can customize this as well. Of course, defining or perhaps redefining your hairline. You'll see some pictures which are very representative for a lot of us. We mentioned volume and thickness to thinning or existing hair. We certainly can work within the hair that you already have to restore that thickness and that volume. And preventative. So I remember working specifically with a gentleman who was probably in his late 30s, and he was thinning. He was wearing hats all the time, really starting to kind of be aware of it and feel insecure about it. So a big part of his life and something he was experiencing every day, but based on the way that his dad and his grandpa aged, he knew it would continue to happen, right? He could kind of see that writing on the wall. So his question was, do I wait until I need to have it done, or do I do it, while I'm really seeing it happen and while I'm really noticing it? And he decided to go for it. He was in kind of the prime of his life. It was something he was noticing every day. He was feeling it in his professional life and his personal life. So he really wanted to do it before it was too late, before it was from A to Z, and really capitalize on the hairs that were there. And he got a beautiful result. So preventative is a way you could look at that. Doing it before it's too late is a way you could look at that. And then also just being able to enjoy the results when you want to enjoy them, and not having to wait to kind of that point where, okay, now it's a really big issue and I need to address it. Doctor spoke to this, but of course hair does thin over time. As humans, we do continue to age and go through those seasons of life, but we can kind of plan for that, be aware of what your natural pattern is, and be able to stay in contact with you to make sure that we're restoring that result for as long as possible. You're going to see a couple pictures here, and this one is not super uber clear as I'm seeing it here. So I'm going to slide to my next one and you'll be able to see a lot more clearly. So this is what we're looking at pre-op, day 1, and 5 days out. And if our camera boxes, where Dr. McCracken and I are over any of your screen, you can move us around. So I'm going to go ahead and move us down a little bit so I can see my full screen here. So this is what you're seeing a day out. This is what you're seeing 5 days out. As you can see, 5 days out, that donor site is healing up really nicely. Again, like Doc said, we're coming in, and just kind of taking what we need there, leaving what we don't, and that's why that donor site will heal up so nicely, really within a week or so. We mentioned being able to treat all hair types. Doctor, do you want to add something there?
There are some subtleties with different types of hair. We have done African American hair. We use a little bit different punch. The most important part about the extraction process is making sure that we don't just get a hair shaft, but that we actually get the hair follicle. If we just get a shaft, then it's not going to grow new hair. Only if we get the follicle will we be able to regrow hair over time. And so we have to take a little bit more precaution with African American hair, or curly hair for that matter. We use a little bit larger punch just to make sure that we get the follicle. Yeah, there really is no ethnic restriction that would make someone not a candidate for this.
And one of the very reasons why, we do love FUE versus maybe some of the modalities of the past is there are certain things out there that can't do ethnic hair, can't do gray hair, whereas we can with FUE and with NeoGraft. So yeah, great results all across the board there. Sorry, I thought I cut you off on the slide before. I wanted to make sure you didn't have anything to add on that one.
No, and well, I'll say this. A lot of guys want to, or gals want to know, when will I be able to go back to work? When will I be able to go out and do things socially? Personally, I saw patients the day after my transplant, but everybody knew I had a transplant. The back of the head can be one telltale sign that you've had something for the first week or so until your hair starts to grow back. And the other thing is that the transplants, as you can see, there's little scabs around the recipient sites, the new follicles that have been transplanted. And so that can take anywhere from 1 to 2 weeks before those scabs fall off. So, I see people all the time that have been to some of these chain hair places, and they'll tell patients, oh yeah, you can work the next day, and patients have no idea what they're going to look like. But if you have a major event coming up, a family gathering or wedding, something like that, I think at least 2 weeks just to be on the safe side.
Absolutely. And what you're seeing here is 4 days out. So, to speak a little bit to that scabbing, a little bit of that healing, which is exactly what we want to happen, a pretty good visual representation there. And a really big part of the expertise of Dr. McCracken and his team is designing your hairline. So most of us, you know, want to look like ourselves still. We just want to look maybe about 10 years younger, maybe about 15 years younger. So we will go through a process with you specific to your concern about redesigning that hairline and making sure that it's really going to look natural at the end of the day, and that you're going to feel comfortable in looking like yourself. Again,
the hairline, if I could just interject, is something that's very, very important, and something that we do a lot of planning for. We'll talk to patients ahead of time, and the day of, we'll kind of mark things out, let the patient comment. We can make alterations, make sure that they feel things are even. Patients sometimes will want a hairline that's actually too low, and sometimes that can look a little age inappropriate. We want you to look like, you know, someone your age who has a good head of hair. We're not trying to make a 50-year-old guy look like an 18-year-old. That just doesn't look right. And it also allows us, the further down we go with the hairline, the less density we're able to provide with a given number of grafts. And so keeping an age-appropriate hairline prevents you from looking somewhat silly, and also allows us to use greater density of grafts in the area that we do end up grafting.
Absolutely. It's almost kind of similar to, you know, maybe some of our folks who maybe have seen us for other anti-aging things, right? Is, you know, we're not trying to look 20 when we're 50. We're trying to look maybe 40 when we're 50, and really just, if anything, look really great for our age. So it's a really important thing, you know, to look, yes, age appropriate, but look fantastic for where you're at. And what you're seeing here is that progression over time. So of course you can see temples on this gentleman, and then of course really thinning throughout, and quite a result over time there. Again, really important for a lot of people to be able to treat kind of that widow's peak, if you will, those temples going that much further back, and then the crown. So this individual got restoration in a big area. And a lot of times what we're seeing when we're looking at, you know, area we can restore, you're kind of looking at, you know, as big maybe as your hands might be. So if you can kind of picture where that would be, almost like a CD, is something that I'll hear compared to a lot of how big of an area we can treat. This is going to be specific to how many grafts Dr. McCracken thinks that you need to achieve the result that you're looking for, which is exactly what he's going to determine in your virtual consultation. So do want to make sure that you get that scheduled if you don't already. This is an example of about 750 in terms of grafts on each side that you're seeing within that temple. This person was very happy with their result. And again, speaking to being able to treat different hair types, speaking to that hairline, we really want to restore what's going to look natural, fill in that density, and create that hairline as it looked. We spoke a little bit about females. Females are going to lose hair a little bit differently than males most of the time. That's not to say it's not a huge concern for a lot of us. And, you know, we know men are going to lose hair, right? That's kind of their rite of passage as men age. We know that's something that's going to happen, whereas we as women maybe don't feel that coming. So it can be somewhat surprising as we're thinning. It can be very troubling for us as we're going to blow dry our hair and all these different things that we're really feeling a lot thinning and happening in there. So for our females, it may look a little bit more like restoring density. It may look a little bit more like restoring that hairline, but just know that both men and women are great applicants for this FUE procedure. I asked Dr. To send me specifically some of his, and I was blown away by these pictures, and they're really great examples of the different types of restoration. So this gentleman had he's thick hair, right? I mean, he's got a good head of hair. And really what we're seeing is that hairline receding, which we've gotten a beautiful result in, and really seen that over time in an example of gray hair, which historically with different modalities we were not able to treat nearly as effectively as we are with FUE. So it's a beautiful example. Huge life changer for this gentleman. You can see that we really redesigned that hairline, and not only redesigned the hairline, but the density and the thickness of what we're seeing throughout the crown and really throughout that frontal temple area. Really, really nice change. And then my favorite, showstopper, amazing result before and after. So most certainly this individual's life was changed. This is something that is, huge noticeable difference, not only obviously density wise all throughout the center there, but of course really restoring that hairline and looking much more youthful. Those front wispy hairs really blow my mind compared to what you've been able to achieve result wise within our secondary one here. And to speak to that donor site even before, on the sides and throughout the back, donor is going to be back here, but really has a pretty good thickness in those areas and a pretty good amount of hair growth. So by restoring it where we were lacking, we've really restored the youthfulness of the head overall. Let's speak a little bit about contraindications and before and after, Doc, before we open it up to some questions. Major contraindications, meaning things that we would definitely want to speak to you about before having a procedure. Like I mentioned, this is done in office, so if you have any allergies to lidocaine or any type of numbing agents, we'd certainly want to be aware of that. Doc, do you guys use tumescent in your office as well as lidocaine?
Yeah, we use a dilute tumescent solution.
Okay, perfect.
I'll give nerve blocks, which usually do a pretty good job of keeping things comfortable during the injections. And in addition to that, we also have Pronox, which is nitrous oxide, kind of like the dentists will use. Some people call it laughing gas. And that, I think some guys probably enjoy the laughing gas as much as they do their results of the procedure. But anyway.
I would not argue you with that.
It really takes the edge off and allows us to do the injections in a much more comfortable way.
Beautiful. Yeah, Pronox is a wonderful addition into the office. That's great. The ability or inability rather to be able to go off of blood thinners for your procedure. That's certainly something that you're going to want to speak to the team about. Dr. drove this point home, but I want to make sure everyone understands that those grafts are really being taken into their new home or their recipient site by a blood clot. So of course we want to be able to have your body have that natural reaction, have that blood clotting, have that scabbing happen around, and really make that follicle's new home in the recipient site. So blood thinners are something that we do want to have that conversation about, and we do like to recommend that if you're a smoker that you're stopping at least temporarily. Any kind of smoking is going to be a vasoconstrictor, meaning that it's going to lessen your blood flow, and of course to speak to that point before, we do want that blood flow to be healthy, going to those grafts and clotting appropriately. So we do request if you're a smoker that we're aware of that. We can help you manage that for that time period as well. We won't get too much into the nitty gritty of the prep the day of and kind of what to expect, but just to give you a little bit of information, you do want to avoid alcohol the week before your treatment. We spoke about smoking just to really get the best healing result. We like our folks to wear a button-down shirt, nothing that goes over your head. Again, we want to keep those grafts nice and pristine for the first, at least 10 days or so. Be really careful with scraping anything over the top of them. So button-down shirt day of procedure. We will give you a couple medications that you're going to want to fill a couple days prior. Most of the time, we're going to arrange for transportation to and from, make sure we're keeping you safe. And then, of course, we will have designed your hairline. But if you liked us to show a photo of your hair when you liked it, that would all be pre-procedure. Day of procedure, generally you're going to arrive fairly early, eat a good breakfast. Make sure you have your medications. Those are going to be given to you prior to surgery with your FUE, and then your pre-op photos will be taken for chart purposes. If your hair is gray, you do not have to color it yourself. We'll color it for you. That just allows us to see the grafts more effectively. If we need to shave your hair, we'll be doing that for you. Again, based on the way that you're wearing your hair now, Doctor and his team will really specify what they're looking for you to do to prep. But do be aware that if you do need color or shaving, that we would be handling that for you at the practice. We don't want you to wash your hair the day of, but the day before you're going to use an antiseptic soap just to really get the area prepped for procedure. Post-procedure, again, don't feel like you need to write this all down. They will certainly go through all of this with you in detail, but just to kind of give you a little foresight there, no alcohol, no ibuprofen, no aspirin for about 48 hours after surgery. Like Doc mentioned, when he went back into office and was taking patients after he had his hair restoration procedure, generally a pressure gauze is going to be around for maybe the first day or two. And then as that comes off and your donor site's going to start healing up, we'll often recommend a bacitracin area ointment to that area a couple times a day. That really will help aid that healing as well. You're not going to wash your hair for a couple days after. We will give you specific instructions. Doctor alluded to it, not putting your hair directly right in the shower stream. A lot of times that's going to look like a big cup of water that you're kind of very gingerly going over there. Don't go right under the shower spray. Don't touch your grafts directly. And of course, the team will be really walking you through that and making sure that you know exactly what to do and exactly what not to do. Hats can be worn after surgery. I want to say that we discussed, maybe, what would you say for this, Doc, for the hats? When somebody says, hey, can I wear a hat? What do you say to them?
Certainly not for the first 48 hours. A lot of guys want to wear a traditional baseball hat. They want to wear a beanie. The hats that are okay to be worn for that first 2-week period are like the trucker hats that sort of come up like this. We don't want anything that's going to touch those grafts, anything that might tear some of those grafts out. So as far as I'm concerned, the name of the game with this procedure is just babying these grafts for the first couple weeks.
Perfect. And then as far as your Rogaine, anything like that, then they would let you know exactly when to bring that in post-procedure. We've mentioned minimal downtime, and that can look and sound different for everybody. So to break that down a little bit, generally working after the procedure is fine, depending on what you do. The team will certainly be helping you figure out what that looks like. Normally your household duties are absolutely fine. And then we mentioned no strenuous exercise or excessive sweating for about 2 weeks post-procedure. It is normal to have some swelling, generally on the second or third day. We'll give you some tips and tricks on kind of how to avoid that. Things like you would intuitively think not laying all the way flat when you go to sleep, using some ice in the area, light massage on the forehead can often help. So normal to swell, and we'll help you manage that as well as we can. And normally that happens about the second or third day after procedure. During your procedure, you are indeed awake. So if you need to bring your iPad or your laptop, whatever, in my experience, most of the time it's an opportunity for people to chill for the day. And they don't like to do a whole lot during procedure, but you are awake, so do be aware of that. Doc, most of the time, are you guys doing the majority of the procedure in the morning, breaking for lunch, and then finishing in the afternoon?
We've done it both ways. Some guys want to break for lunch, and we're happy to do that and bring something in for them. A lot of guys lately have just wanted to kind of just go through with it. And so a lot of times we've just been going straight through, and it kind of cuts down on the time of the procedure. So it's really patient dependent. We're happy to do whatever the patient likes.
Awesome. Yeah, a lot of times people do just like to get in and get it done. And then are you recommending transportation to and from the office?
Yeah, we don't think it's a good idea after taking the oral medication, the Valium, to be driving. So we do recommend having transportation taken care of. And for out-of-town patients, we are able to help with special pricing in a local hotel.
Absolutely. I've driven a hair patient or two myself, so I hear you. Just to reiterate here, top 10 reasons why people are really excited about FUE. Again, it's a very short recovery time. You're pretty, non-restricted on what you can do and not do afterwards. It's least invasive, no stitches, no staples, no visible scarring, and really just the efficacy, that 95 to 98% take rate is what gets us really excited about having our hair restoration procedure. So we are going to go ahead and move toward our virtual consultations. We did have those wonderful prizes. Again, they were a free PRP treatment, which is an $800 value, help enhance and maintain your results of your hair restoration procedure. We also have a Skin Medica kit, and we have our 1 syringe of filler, which is Restylane. You can use that in a whole lot of different ways that the team will help discuss with you. We don't want to name winners because we do want to protect your privacy. So we will be letting you know in your virtual consultation if you've won. And that's where we'll be going over pricing and protocol with you. So again, if you do not have a virtual consultation scheduled, you can go ahead and reach out to us via phone. You can just call the office and they'll go ahead and get one set up for you. Or while we're going through our Q&As in just a minute here on our next screen, you're welcome to go ahead and put your name and phone number in the Q&A and the office will reach out to you. We did record this webinar, so everyone's going to be getting a recording of this event, and then on that email, we will put the winners of the initials, just so you guys know that we did actually choose people, but again, we do want to be aware of your privacy. So we will let you know very soon if you've won one of those prizes. We'll let you know about the benefits of savings that you're going to be receiving for locking in today, and that's all going to be on your virtual consultation. So I do have a couple questions that have come through during our presentation that we'd like to ask Dr. McCracken. If you are listening to these and you do want to put anything into the Q&A, we'll do our best to answer as many questions as possible. So the number one question that always comes up, doctor, is does it hurt?
When we touched on this a little bit, people are worried about pain afterwards, and really there's very little discomfort afterwards. The worst part for most patients, and I can speak to this when I had mine as well, is just the numbing injections. But before we do the numbing, we do a couple of nerve blocks. We use an intramuscular injection of a Motrin-like medication to help with comfort before that. And we also are now using the Pronox, and I find that most of our patients do really well through that whole process. The addition of the Pronox or the laughing gas, I think, has been a big part of that. So really, I think there's very minimal discomfort for this procedure.
Wonderful. And a little bit more of a specific question here, but I think it's great. How many follicles are typically transferred per session?
And this is really patient dependent. Nationwide, the average is somewhere in the area of 1,750 to 1,800, I want to say. The biggest transplant I've ever seen was 3,000 grafts. We've done a case here of about 500 is the smallest we've done. So it's really dependent upon the amount of recession, and it's very patient dependent, and sometimes it can also be dependent upon budget.
Okay, awesome. So really customized per person.
Yes.
Okay. And will the grafts take equally on a receding forehead as they would the crown?
Yes, we do both areas. I think the forehead is more common actually than the crown, but both areas work just as well. In patients who have both thinning in the hairline and the crown, my advice is always to start in the hairline. That's going to frame your face. It's what people are going to see when they meet you, when they talk with you. We can always put some in the crown, but we always try to make the hairline the priority. But there's no reason that these grafts can't take equally as well in the crown or the forehead.
Okay, perfect. Hair color afterwards. Are patients allowed to color their transplanted hair? And if so, how long after procedure?
A little bit of that is patient dependent, but usually somewhere in the 2 to 4 week range, it's fine to start doing hair coloring. This is your hair, and once it's set up after a couple of weeks, it's just like just like it was in the back, or just like the pre-existing surrounding hair. So you can do pretty much whatever you want with it.
Okay, great. And somebody had a question about a pacemaker or metal in the body. Are there any contraindications with FUE with having a pacemaker metal?
There are no contraindications to the FUE procedure. Someone with a pacemaker would need medical clearance from probably their cardiologist to have the procedure done. But as long as they're healthy enough, there's no electrocautery that could interfere with the pacemaker. So there's no reason that the procedure itself would affect the pacemaker.
Awesome. We've got some great questions coming in here. I'm going to ask you maybe one or two more. Does everyone have to have their hair shaved?
In order to get the follicle out, it's very helpful to shave the back of the head, the donor site. Now, there are different ways of doing that. The recipient site oftentimes does not need to be shaven. For example, we showed an example of grafts being placed in a patient that was thinning, and those pre-existing hairs were all still in place and not shaven. So the most common time this comes up, I think, is with female patients that don't want to shave the back of their head. And in females, oftentimes, if they have long enough hair, we're able to lift up the hair and shave a little segment down below that, and we're able to get the follicles out that way, and then let the long hair hang down, and that does a really good job of hiding the donor site.
It's a nice camouflage method, isn't it?
Yeah.
Last question, it's a great one. Are grafted hairs inserted with inclination to match their hair pattern?
Yes, of course. That's one of the most time-consuming things about putting the follicles in. What we do is however many grafts it's going to be, say it's 1,500, 2,000, we take a needle and individually place all of those recipient sites, and we match the angle of the existing hairs. There's nowhere that's more important than doing an eyebrow, for example, but certainly that applies to the crown, and certainly that applies to the hairline. So wherever we're putting these in, we try to match the direction of the pre-existing hairs.
Beautiful. All right, very good. Well, those were awesome questions. Thank you so much, everyone, for submitting those. We covered a lot of ground there. And there were a couple that were a little bit more specific that, again, if we didn't answer anything, we just wanted to kind of generalize them there and be respectful of everyone's time. So if there wasn't your question asked individually, do make sure that you see Doc for your consultation. Somebody had asked, they already have a consultation booked. Do they need a virtual one? So glad people can actually book regular consultations now when we're back seeing people in our office. So no, if you have a regular consultation scheduled, you are welcome to keep that. You don't have to do it virtually, but do be aware that the pricing of this specific event and those savings are only good until next week. So what I would suggest is to call the practice tomorrow and make sure that when your appointment is booked, you're still going to be able to take advantage of the event savings if you are not going to do a virtual consult. And if you do want to go ahead and do virtual, you can just reach out to the team. I'm going to read the phone number here. So if you do want to call the office, go ahead and grab a pen. I'm going to give you the phone number. And the office number is going to be 720-851-6600. So if you have a consult scheduled already, do make sure to reach out, make sure it's going to be in enough time for you to get the event savings. And again, if you don't have virtual scheduled, go ahead and reach out so we can get one set up for you. If you do have a consultation on TheraLink, you're going to get an email 15 minutes before. That's going to have a link in there that you'll go ahead and press when it's your time. It's going to take you into that HIPAA compliant platform, and Dr. McCracken will enter you into your consultation so he can take a look exactly what you're experiencing, develop a treatment plan for you, and you can lock in those savings from being with us here today. If there are no other questions, I don't think I see any others coming back in there. We will go ahead and thank everyone for joining us today. It was
thank you all.
Great to go through the information with such an awesome practice and provider. So we look forward to seeing each of you in your individual consultation. Reach out if there are any other questions we can help answer for you, and best of luck to our prize winners.
Are we going to do the drawing now, or are we just going to do that?
I didn't know if the girls were going to come back on camera. Are they rejoining
they're not
us?
on camera. Okay, well, if we're not announcing the names, we can just do that offline.
Yeah, we'll protect everyone's privacy. We were just going to do baby initials here, but I don't know that we've got our fishbowl ready, so no worries. We'll just let everybody know individually if they won a prize, and like I said, we will be sending out an email to everybody that'll at least have the initial winners on there. So if you haven't found out that you won in a consultation, then we'll let you know afterwards in our email.
Very good.
Wonderful. Anything else to add from your side, Dr. McCracken, before I go ahead and close out our webinar?
I just wanted to again thank everyone for spending some time this evening with us, and we look forward to seeing you soon.
Absolutely. Take care, everyone. Thanks so much.
Bye.
We'll see you in consult.